Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Heather Williams. She's a gynecologic oncologist at UAMS, and she's here to help us better understand HPV, prevention, and why screening and vaccination matters. Dr. Williams, thanks so much for being here.
Thank you so much for inviting me to speak on these topics. They are very important.
So most people have heard of HPV, but many still don't understand what it is. Can you explain what HPV is and why it's such an important public health issue?
Yeah. So HPV stands for human papillomavirus. It is a sexually transmitted virus, but the majority of people will have had exposure to it around by the time that they're around the age 45 or 50. So it's pretty ubiquitous, and it's a primary cause of several cancers for both men and women.
So you mentioned men and women. We often think of HPV as a women's health issue, but that's not the full story. I mean, what cancers and diseases can HPV cause in both men and women?
Yes. So predominantly when we think about HPV, we do realize that cervical cancer is the majority of what is caused by that virus. But for men, actually, it's responsible for about 46% of cancers that can arise in the head and neck area, but then also anal cancer and penile cancer as well. In the United States, we do see the head and neck cancers, but predominantly around the world, it's still a really big issue for men as well.
And some of the newest research on the HPV vaccine is making headlines. What are the biggest findings that people should know about?
Yeah, so the HPV vaccine was approved in 2006 and has been implemented around the world since then in mostly places that are industrialized due to cost and things. And so some of those countries took charge and made it mandated for young children, adolescents to get vaccinated. So what we're seeing now is in those countries that have mandated vaccination, that their rates of cervical cancer in these age groups are actually declining. And so this is like phenomenal because, for instance, in the United Kingdom, they just released a report that they basically have almost diagnosed no cervical cancer in women under the age of 25 for the first time. And this is thought to be due to vaccination with the HPV vaccine.
That's a significant milestone. I mean,
It is huge.
Are we seeing that here?
We are not seeing as a grand success story, but we are seeing decreasing rates of cervical cancer in that younger age group, and that is thought to be attributed to our increased HPV vaccination uptake. So there was a report that was released in January of 2024 reporting on cervical cancer incidence in the United States. And there was a decrease in the rate, but certainly we have not gotten to the point where we are almost eradicating it.
So for years, we talked about how the vaccine preventing HPV infections, but now it's really moved into the talking about preventing cancer. Has that conversation changed?
It has, and this should have been the conversation all along. So cervical cancer is diagnosed in 600,000 women worldwide each year, and about 350,000 women die from cervical cancer each year worldwide. And certainly here in the U.S., our numbers are not that high because there is an effective screening tool for this cancer. But regardless, no woman should be dying of cervical cancer in 2026 because we do have an effective vaccine and we also have an effective screening tool for this. So this should have been the conversation all along, that it's cancer prevention, which is super unique to cervical cancer because it's basically the only cancer that has both an effective vaccine to prevent it and also a screening tool that women can get.
So, and another question people ask is whether the protection lasts. So what does the latest research tell us about like long-term effectiveness of the vaccine?
Yeah, so long-term follow-up of these patients that were vaccinated early on when it was first released is that they do have long-lasting immunity. And so therefore, that's why a booster shot is not recommended yet at this time.
So how is Arkansas doing when it comes to HPV vaccination compared to the rest of the country?
Well, we could do better. Our vaccination rate as an average is around 60%, which is on kind of par with other states in the South. But we are lagging behind the northern states and the western and eastern. Some of them have vaccine rates approaching 90%.
In some recent research, you talked a little bit about this national or international stating that HPV vaccination rates have seen larger declines in cervical cancer, while Arkansas has made slower progress than many states. So what do those findings mean for us?
It means we have more work to do. I think it's really important that the right message gets out from the right people. I see the women every single day that did not get the vaccination either because it came out before, or after they were past the age limit for it. And I see these women with these cervical cancers, and they are horrible things that these women have to go through. Treatment wise, it will rob them of their ability to have children in the future. And then obviously worst case scenario, it takes their lives and they leave behind often small children. I see it basically every week we see new cervical cancer cases, and to know, that there is a way to prevent this, it just means that we got to do better to get the message out so that I can eventually not have to treat any cervical cancer patients.
So what are the barriers that you keep seeing Arkansas families from getting vaccinated?
I think there's a lot of misinformation, of course, about side effects and what it's for. And then I think also just maybe a lack of access even. We are a very rural state and not everybody has a physician or provider there in their hometown. And so they may not just have access for regular screenings and vaccinations. And so we have to make sure that we're getting the word out to these families so that they can best protect their children in the future.
And if someone receives the HPV vaccine at the recommended age, what does that mean for their long-term health?
So, long-term, the vaccine has been proven to be very safe. Like I said, other countries mandated vaccination, and the poster child for that is the country of Australia. They mandated the vaccination when it first was released, and they've had millions of doses that have been given. And so there's a lot of long-term data there, and there are no concerning safety signals as far as things that would affect women's fertility or increase risk for other infections or anything of that nature. So I think that we can say that this is a safe vaccination with a huge benefit, because the country of Australia is on par to not have any diagnoses of cervical cancer in the next 5 to 10 years. So they've essentially wiped out cervical cancer, which is just huge, because what other cancer can we say that we've done that for? So I think that basically, having that information to be able to give to patients and help them understand and show them the data will allow them to make the best decision for themselves and their family.
So it's parents that wonder if vaccination means that their child no longer needs cervical cancer screenings later in life. Can you explain why screening is still important?
Certainly, getting your screening will still be important, because there are, unfortunately, some cervical cancers that are not caused by HPV. They are definitely in the minority, but it will be important for patients to not give up on their screening yet until we have more information about the best course of action. in a post HPV vaccination period. So screenings are recommended. If you are between the ages of 21 and 29, it's recommended that you get a pap smear every 3 years. And if you're over the age of 30, it's recommended every 3 to 5 years with HPV testing. And that's just because as we get older, our immune system does not work as well. And so if we do carry that virus, it is more likely to cause cancer as we age because our body can no longer suppress it.
So what ages are recommended for vaccination? And is there still a benefit for adults who may have missed that window of getting vaccinated even as a child?
Yes, so the vaccine is approved to start, it's recommended to start at age 11 to 12, and it has actually been shown to be safe even down to age 9. But age 11 to 12, and right now there is a recommendation for 2 vaccinations for that age group up to age 15, and then after age 15 up to 3 vaccinations to complete the series. And that goes to age 26. If you are someone who has increased risk factors for HPV exposure, you have never been sexually active, you do not have the virus, then that can be considered up to age 45 in certain situations. And so I think just, speaking with your provider or physician, if you fall outside that age range up to age 26, to see if that's the right thing for you.
And our primary care providers, pediatricians are often those frontline information for parents to give that information. What should that be? What should they be telling their patients about getting that HPV vaccine?
Well, first I want to tell the providers in the state of Arkansas that we are the second highest rate of cervical cancer diagnosis in the country right now. And we have the third highest rate of patients diagnosed with advanced disease, which means that their overall life expectancy is going to be significantly impacted by this cancer, and that we have got to do something to make a change. And I do believe that it does start with them in making sure that their patients have the right information to make the best decision for themselves. It is a cancer prevention vaccination, and not only just for women with cervical cancer, but again, also for head and neck cancers, which we see a disproportionate amount of in Arkansas as well, because again, smoking is a risk factor for that as well and increases the risk of these head and neck cancers and cervical cancers. Also, not just the cancer, but there's a whole series of diagnoses and testing and anxiety and worry that comes even before then, because you get a pre-cancer first. And so if you have a pre-cancer of the cervix, that can lead to more procedures on the cervix that can impact a person's fertility or ability to carry a pregnancy to term. It can also cause abnormal findings in the vagina and then also on the skin on the outside, the vulva. So the entire genital tract can be impacted. And if a patient does have HPV and they deliver their baby can contract HPV and have it in the oral pharynx as well. So there are a lot of other impacts to this. And again, we are preventing cancer and pre-cancer with this vaccination. And again, it has been shown to be safe because it's been given to so many people worldwide. And we are blessed here in the United States that we do have access to this vaccine and that it is covered by insurance. Because again, I just told you that 350,000 women are dying each year, and that's predominantly due to the fact that those women do not have access to the vaccine, nor do they have access to adequate screening. So it is my hope that in my lifetime, I will see no cases of cervical cancer.
I hope that is the case as well. And for those that would need more information about vaccination hesitancy or just to learn more about HPV and resources, where should they go?
So the Center for Disease Control has information about the HPV vaccine and the vaccine schedule, and then also the Arkansas Department of Health, the Immunize Arkansas, and then St. Jude's, which is currently leading HPV elimination coalition for the entire southern part of the United States, because we do see such high rates of cervical cancer here across the South. And so St. Jude's has a lot of information as well if you go to their website.
Well, Dr. Williams, thank you so much for joining us and for sharing your expertise. We've learned so much today. Thanks for being here.
You are so welcome, and thank you for having me.
And that's it for this episode of AFMC TV. Have a great day. Thanks for watching.